Hello everyone and welcome back to my channel, and in today's video I'm going to be talking about social anxiety and how it can affect people in their daily lives, but also just everything included. So let's go ahead and get started.
And trying to remain so strong. I know it's good if I'm alone. I got it.
But before we get started, I just wanted to put a little disclaimer out there. I'm not a health professional. I'm not somebody who's got any sort of certification in healthcare. I am just somebody who knows that sometimes watching YouTube videos and listening to people talk about a condition can actually be easier for me to digest and understand rather than having to read things off a website. And some of these conditions that I'm doing in this series have a lot of things to read. So sometimes listening to someone talk about it and sharing their experiences with it and things like that can help me to understand it better. So I will leave any links to what I'm talking about in this video and any of the videos in this series, which I think is called the What Is series, in the description box down below. So if you want to read all the information, you can. But this video is just to help those who struggle with the reading, because I'm one of those people. Social anxiety, or a social phobia, is a long-term, overwhelming condition that affects people when going into social situations. It is a common disorder, and it usually affects people or starts affecting people in their teenage years, but can last the whole of their life. It can be very distressing and can impact more than just when they go out and socialise. It can impact going to school, it can impact going to the shops, going to the post box, it can affect anything. It's important that if you're having symptoms, to take some treatment to help you to manage it. So the symptoms, talking about the symptoms of social anxiety is worrying about everyday activities such as meeting strangers, starting conversations, speaking on the phone, work or shopping. Any of those things that involve seeing, talking, going past other people can be very anxiety provoking for those of you who have social anxiety. You may avoid or worry a lot about social situations. So for example, you're at school, a friend has said to you, "Oh, Tammy," I don't know why I said Tammy, but "Tammy, do you want to meet up on the weekend? And do you want to go to the cinema?" You go, "Yeah, I'd love to," because a lot of people who have mental health conditions, they mask. And they go, "Yeah, I'd love to." After you said, "Yeah, I love to," you start worrying and you start going, maybe I don't want to go to the cinema as much as I would ideally want to go to the cinema. So, yeah, that can be something that happens, like a hindsight of you've said yes, now you feel compelled to do something that you've said yes to, even though your anxiety is now going, this is anxiety provoking. My anxiety is anxietying, as I say about some other conditions that I have. So you might also worry about things that you do, such as blushing, things you can't even help. Blushing, the way you walk, the way you talk, things you say. You might worry about all those sorts of things, and you may try to think about situations before they've actually happened and try to plan them all out in order to make it easier for your anxiety. Like plan it out and have different ways you'll respond to different events that might happen from somebody else. And I do this a lot. I don't have social anxiety. Well, I have social anxiety as part of another condition, but I'll be talking about that in a few weeks' time. But it's not nice, it's not easy to constantly be planning activities, planning all these different things just in case this happens or just in case that happens. Another one is fear of being criticised, avoiding eye contact, having low self-esteem, often having physical symptoms like feeling sick, sweating, trembling, pounding heart rate. All those sorts of things are more physical symptoms but are symptoms of anxiety. You may also have panic attacks, which is very, very hard to describe if you've not had a panic attack, but it is basically where you have an overwhelming sense of fear and anxiety, and usually it only lasts for a few minutes but sometimes can last for a bit longer, and they are really, really scary when you're in that moment and really, really scary when you're actually having that panic attack. So if you've not had one, it's quite hard to describe, but that's kind of my best chance at it. So now let's talk about when you should get help for social anxiety. It is a good idea to talk to your GP, especially if you're here in the UK, because this is all UK related, if you think you have social anxiety, especially if it's having a big impact on your life. It is a common problem and there are many treatments that can help you to manage your day-to-day life. Asking for help can be difficult, but ultimately can help you to manage your life because there are many treatments available which can make your life a lot more bearable. Your GP will usually ask you about social situations, ask how it makes you feel, ask for other symptoms, ask about physical symptoms and mental symptoms in order to make sure that the treatment they give you is the treatment you need. But if you don't want to go to your GP, you can actually refer yourself directly. So you as a person can go on the NHS Talking Therapies and you can refer yourself directly to them. You don't even need to go to your GP. And if I can find the link, I'll leave that link in the description box down below for you guys just to go there if you need to do talking therapies and talk. I don't know what they offer, but if you want to self-refer, then I'll try and leave the link down below. Things that you can try to do to overcome your social anxiety may include try to understand more about your anxiety, what it triggers within you, how it triggers you, what triggers you, and then how you can manage those triggers and how you can manage your anxiety. You can try looking into relaxation techniques. Some people love white noise, brown noise. Some people like the meditations and the ASMR, all those different things. Find out what works for you. Another thing you can try and do is focus on here in the moment, focus on what that person is saying and focus just on what that person was saying rather than what you think they might be thinking or saying. Like rather than planning a situation in advance, try going into that situation and listening to what they've got to say and then pausing and thinking about what you want to say back and then responding. It's okay in a social situation for them to say something and for you to not automatically go and say something back. It's okay for you to go, let me just think about what I want, not like physically say to them. You can if you want to, it depends how comfortable you are with them. But it's okay to take a pause, take a breath, and then say, this is my response. Because sometimes you just need that extra 30 seconds to think about a response rather than saying something you'll regret and then would worry about later on. So when you've had a challenging situation, try sitting down with somebody or on your own and breaking that situation down into small little parts. Do a timeline, think about a situation that you've gone through and think about why it became challenging and how you can prevent a similar occurrence from happening again. How you can realise that you're starting to panic before you actually get to the point of breaking and having a panic attack. The treatments for social anxiety, the main one is CBT, which is cognitive behavioural therapy. I myself have had cognitive behavioural therapy twice, DBT, which is dialectical behavioural therapy once, and for me they've taught me some particularly good techniques, but overall did not help me because I don't have social anxiety. I have anxiety as part of another condition, which I said I'll be talking about in a couple of weeks, so stay tuned for that. Subscribe if you have not already so you will get notified. Do that little bell icon so you'll get notified when that comes up. But I was recently diagnosed as being autistic and I'll be talking about that, as I said, in a few weeks' time. Another type of thing that can help social anxiety is guided self-help. So this can be done through the NHS Talking Therapy, so you can self-refer to that. Another one is antidepressant medications. Antidepressant medications such as sertraline can really help those who have anxiety or depression. And I was on sertraline for a good 2 years and it really helped. So it was really good for me. I did get a really good 2 years of being stable on it. So I would recommend it if you don't want something that is higher, like on the antidepressant spectrum. You want something fairly low grade but would still help you. There are a few support groups that you can go to, such as Anxiety UK, a Health Unlocked Anxiety Forum, which actually is on here it's run by AnxietySupport. Go and have a look at it. I'll leave the link to this actual page down below so that you can go on it and click on the links directly, because there's actually links on the page. There's also another one called Triumph Over Phobia or Top UK. Go and have a look at them. They all look really good, to be fair. I've not tried them, but yeah, if you try any of them out, if you have a favourite one, comment it down below. Let other people in the community know which one is the best, which one you think is the best and why. You don't have to comment why you went to that particular one, but it'd be lovely to get some feedback as to which one you think is the best. So now I'm going to briefly talk about anxiety in children. For any of you who have children or who have anxiety yourself and then you're thinking about having children in the future, or who have clicked on this video because you want to see if any of it applies to children, this section applies to children. So social anxiety in children, because some children can't say how they actually feel. This can manifest in crying or getting upset more often than usual, getting angry a lot and not knowing, and when they're asked why, them not knowing why. Also avoiding interaction with children and adults, spending a lot of time alone and doing a lot of lone play. Fear of going to school or taking part in social situations, not asking for help in school, or being very reliant on their parents or carers. These can all be symptoms of social anxiety in children. So it's important to speak to your GP if you're worried about your child and then potentially get help for your child, because being their biggest advocate is the most important thing you can do as their parent. And also there is a lot of resources for parents with children that have social anxiety, like how it impacts those children sort of thing. My next video, next Monday, will be delving a lot deeper into the anxiety disorders in children. So if you have a child or really want to know a lot more deeper information about anxiety in children, then please subscribe, put the bell icon on. It'll be in a week's time on Monday. So yeah, so look forward to that if it is something that you feel will be helpful to you, will be useful. It's going to be next week's video. But that's it in today's video. Thank you very much for watching. If you've liked this video, then don't forget to like the video so it can be spread to more people. Comment, subscribe, join the family of my just over 1K subscribers now, which I'm like, oh my gosh, 1K subscribers, amazing. Join the family. We've got such a supportive community over here, and comment. I reply to every single comment, or at least heart every single comment. And yeah, I shall see you in my next video. But please don't forget that I believe in you, even if nobody else does. And I shall see you in my next one. Bye.
Just like you're young again, no, don't you cry. Just get back up again.